Hi, I'm Dr. Shubha Kesari, Chief Consultant Dermatologist and Medical Director, Naipunya Aesthetic Clinic, JP Nagar, Bengaluru. Many of my patients are not happy with their under eye area. They come to me complaining that they're always being questioned about why they are looking so tired and worn out. They are frustrated that people keep asking them whether they are sick or they have not slept well or they are under a lot of stress. They say that in spite of following a good lifestyle, doing good skincare routine also, they have this issue. This is because of the sunken under eye area and the hollows cast a shadow, making them look tired and worn out. Even in young individuals, this can be an anatomical feature, and as one grows older, because of the loss of fat pads in the under eye area, it may look hollow and sunken. No amount of skin treatments like creams or even chemical peels can replace the lost volume. But there is no need to despair. The under eye hollowness can be corrected by a very simple, quick procedure by using dermal fillers. What are dermal fillers? These are actually naturally occurring hyaluronic acid molecules that are present in the skin. These are sugar molecules which add volume to the skin and suppleness to the skin. As one grows older, the hyaluronic acid content reduces. But fortunately, these are available as pre-filled sterile syringes and they can be injected into the areas where there is volume loss to correct the volume loss. These hyaluronic acid fillers can be very safely and effectively injected into the under eye area to correct the hollowness, to make the skin soft, supple and shiny, overall reduce the hollowness in the under eye area to give a more relaxed and refreshed version of yourself. It will not change the appearance in any way, but it will make you look a better version of yourself. Today we are going to be injecting our beautiful Mrs. Dhanalakshmi here. She is 36 years old and she is a very lean-faced individual and has prominent under eye hollows and tear trough, which makes her look a little older than she actually is. She looks tired and worn out. She is actually an employee and she has seen the wonderful results that our patients have got, and she wanted her under eye hollows also to be corrected today. We are going to be injecting a moderate G prime filler into her under eye hollows to make it look very smooth and natural. The procedure itself is a very quick 15 to 20 minute procedure. Basically, prior application of a numbing cream is applied in the under eye area to make the procedure as comfortable as possible. The hyaluronic acid dermal filler is then injected. We use a blunt cannula, which is nothing but a long needle which does not have a sharp tip but has a blunt tip. The point of entry of this cannula is very much far away from the eye, somewhere in the upper cheek area. Then carefully we maneuver the cannula and distribute the product in the right plane in the under eye area and correct the hollows. It is not a very painful procedure because the dermal filler also has the anesthetic lignocaine incorporated into it. So as we are injecting the filler, the area is also simultaneously getting anesthetized, which makes the entire procedure an extremely comfortable one. Once the dermal filler injection has been completed, the patient is very comfortable. They may experience slight swelling in the under eye area, which lasts for about 24 to 48 hours. It is slightly more during the daytime, and as the day progresses, it reduces. This is mainly because the under eye area is a very thin-skinned, fragile area, and even a small ant bite can cause swelling. When we have placed the product, there will be mild reactive swelling which will completely subside. We do give a lot of instructions post-procedure to the patients. They should avoid heavy activity, swim, steam, sauna, scrubbing, rubbing, massaging that area for the next 3 days. They should also avoid any kind of heavy makeup and procedural treatment for the next maybe 5 days to a week's time. because of the use of cannula, this procedure is extremely safe and the chances of bruising are very less, since the blunt tip of the cannula will not be piercing through the small blood vessels that are present in this area. The filler is a long-lasting filler, but since it is a naturally occurring sugar that is present inside the skin, the enzymes that are produced by the skin cells over a period of time tend to dissolve this filler. So after placing the under eye filler, it lasts for about an year and a half and it slowly reduces, after which, if necessary, a repeat session can be taken. The hyaluronic acid blends beautifully into the surrounding tissue and makes it look extremely natural. This procedure is extremely safe, but you should seek the service of an experienced injector. The injector should be a board certified dermatologist or plastic surgeon who has a good experience in aesthetic field, who has been doing these procedures for a long period of time, because the experience and the skill of the injector definitely matters. We need to decide if the under eye filler actually can solve your problem, what amount of filler has to be placed, which particular product has to be placed in order to give you the most desirable results. Technique is very important because there are multiple important structures that are present in the under eye area. So it is very, very important that you choose your provider wisely. They will select the right product for you and inject it in a safe and effective manner. This is a procedure for those who want to look like the best version of themselves, to actually look the way they feel and how excited and how much vigor they have in their life. If they want to convey it, then this is a procedure to opt for.